So my name is Kristina Ayate. I'm a licensed occupational therapist. I've been working as one since 2018. I graduated from the degree in 2017. So from 2018 to 2020, for the first 2 years of my work, I worked in the hospital setting wherein majority of the cases I handled were musculoskeletal. This one includes fractures, dislocations, and nerve palsy. During my stay in the hospital, it was also the time wherein I did a lot of hand therapy and fabricating splints. So, apart from musculoskeletal, I was also able to handle stroke cases and developmental cases, although there were very few as compared to the number of musculoskeletal cases. Um, I in my stay there, I was also able to handle few cases of degenerative conditions such as Parkinson's and dementia. That's it. So from my 2 years of work experience in the hospital, after that, in 2020, it was the time of pandemic. I took a second degree, BS Prosthetics and Orthotics, because it's the only available option for me in the Philippines wherein I can specialize in splint in orthotics. So I took the degree from 2020 to 2024. I just graduated last year from the degree. And while I was taking a degree, I was working on weekends as a part-time pediatric occupational therapist. From the time I started my second degree in 2020 up until present time, I'm working as a pediatric occupational therapist. Um, in the pediatric clinic in the Philippines, um, majority of the cases are developmental. So this one includes autism, um, attention deficit, attention deficit and hyperactivity disorder, and specific learning disability. And on my first 2 years, I was able to work in hospitals. This was in Manila Doctors Hospital and De La Salle University Medical Center. The populations I've handled in during my stay there were infants to old adults. Most of the cases there, just like what I mentioned earlier, were musculoskeletal among adults, working adults, because the population that I dealt with were seafarers, and most of them has hand injuries secondary to the work that they do. In addition to that, um, apart from the hospital settings that I was able to work in during my first 2 years of work, it was also this time wherein I did a little, just few cases of community care, probably five clients for just a year. This is because it's not really common in the Philippines. Most of the clients referred for occupational therapy go to hospital or in pediatric clinics. So after 2 years of practice in occupational, 2 years of practice in the hospital, this is when I started working in the pediatric clinic. So from 2020 to 2024, I worked in the pediatric clinic because it was the only available job for occupational therapists in the Philippines where I can work part time. When I was working in the hospital, it's something that's not possible. You can only work full time in the hospital. But since I was already taking my second degree from 2020 to 2024, I had to work in a pediatric clinic part time. Okay, and then from the time I graduated, 2024 up until present time, I'm currently working in four pediatric clinics. I'm working as a consultant there, and most of the cases that I handle are developmental conditions. So right now, I'm currently working with toddlers up until school age. I graduated in 2017 in BS Occupational Therapy at the University of the Philippines, Manila, and I got my license to work as an occupational therapist in 2018. At the time of my graduation, I was able to attend few seminars related to OT. This one includes splinting, dysphagia, and lectures on handling degenerative conditions. So splinting is something that is interesting to me because I get to make devices that I can see patients use, and I can also visibly see how it affects their occupation. Um, Another thing that I took was dysphagia. This is for adults and kids. However, this practice in occupational therapy with regards to dysphagia is something that I am not confident yet because here in the Philippines, I did not have mentors to help me with the actual practice of management. I only had the lectures. I'm knowledgeable in theory, but I think I need someone to look over me, to mentor me while handling those cases. With regards, I was also able to handle cases with degenerative conditions. This one mostly includes making adaptive tools only. So it was quite easy for me to translate what I learned during in the seminars to practice. So another thing that is under my educational background would be I took a second degree in 2020. This is somehow related to occupational therapy. I took BS prosthetics and orthotics. So it's kind of related because orthotics refers to the devices that patients wear to improve function, which splinting falls under it. So I took the degree because it's the only available option for me wherein I can specialize on something that is interesting to me, so which is splinting. So I took the degree from 2020 to 2024 and I just graduated last year. Um, I am yet to take the certification exam for the degree, BS Prosthetics and Orthotics. Okay, so I'm interested in working as an occupational therapist in Australia, primarily because of the available and accessible resources that I can use to expand my practice as a therapist. I understand that, as far as I know, healthcare system in Australia is something that is supported by the government. So unlike in the Philippines, if it's supported by the government, I won't be limited by the resources I can use, and the patients are not financially limited to continue with therapy that they need. So, apart from the resources that is available in Australia, I am also interested in working in as an occupational therapist there because they value work life balance, which is something that is very difficult in my practice as an OT in the